country, I'm afraid, has passed the gloomy milestone of over 1 million COVID-19 infections. 26,735 people have in total now passed away from the virus. The National Coronavirus Command Council is discussing restrictions to try and slow the rapid spread of the virus. Professor Alex Broadbent, always a pleasure speaking to him, from the University of Johannesburg, joining me now. Professor, good morning to you. Happy belated Christmas. And it's not the kind of Christmas present I'm sure someone in your position wanted to see when we went over that 1 million COVID cases mark, is it?
Thank you. Good morning. No, it's not. Of course, the actual numbers of testing, the numbers of tests are a big part of that, and to some extent it's testament to the fact that South Africa has a pretty good testing regime, that it's detected so many cases. But of course there are also quite a lot of deaths, and that's the really unfortunate thing.
It is as well, and also I think it's worth just reminding viewers, because quite rightly we're always talking about the number of COVID cases. We also need to talk about the number of recoveries. That's the only fair way to have this discussion, isn't it? That I think it's now close to 845,000, or just under that, recoveries as well. So I mean, for someone like you, yes, we're focusing on the million mark, but it's a pretty good recovery rate, isn't it? Or am I being ignorant?
Yes, it is. I mean, the website, if you go to SA Coronavirus, the first thing the government tells people who go to that website is don't panic. For 82% of people, this will be a mild infection. And, you know, it's easy to forget that that remains the case. The difficulty is obviously that it does kill a sizable number of people, which is sizable enough. But for most people, of course, it isn't dangerous.
Let's talk then a little bit, Professor, if we can, about this vaccine, this COVAX, and whenever that's probably going to arrive here in South Africa. One of the questions that's now being asked, because we've been reporting on it, as have many other news networks, America has got the vaccine. Most of Europe has got the vaccine, and yet down here in the south of the African continent, the vaccine seems to be a bit of a distant dream. In fact, we don't even know when it's going to arrive. Have you got any insight for me on that? Where are we on this?
I don't have any insight about when it's going to arrive. I do think, though, it's a problem. I mean, the strategy that the country went into, as some of us have been saying for months, was a copycat strategy. So the country locks down. And the point of locking down is to hold out until you get a vaccine. So the crucial second part, if you are going to go down that route, is to get the vaccine. And globally, wealthy countries are obviously queued up for vaccine orders, and less wealthy countries haven't. That's a problem with the global public healthcare system. From a South African perspective, which is actually a relatively wealthy country in the global order of things, it's an indication that there's a bit of strategic confusion. So again, if one is going to consider locking down, which in response to a development, then one has to look at the end game. And this, that this is the end game. The end game is getting the vaccination. So then one has to get one's skates on for that. If otherwise, one is playing a longer game, and you have to look at different strategies.
There was a bit of confusion, or maybe perhaps a misunderstanding, Professor. Maybe you can speak to this for me if you don't mind. South Africa a bit late, very late to the game when it comes to the ordering and the paying of this vaccine. Was that, do you think, an administrative error and lax on government, or is it because they were being overly cautious and waiting for the vaccines to be approved by everybody else in the world before we did the EFT?
No, it cannot possibly have been because we were being cautious, because if we were being cautious, we wouldn't have locked down. And lockdown would never pass the kind of safety regulations that a vaccine has to pass. It's far more dangerous. Vaccinations and any pharmaceutical intervention has to go through incredible safety checks that, clearly any of the non-pharmaceutical interventions we've tried have never been subjected to and would definitely not pass because they're far more damaging. So no, it cannot possibly have been that. What it will have been is simply just incompetence, administrative incompetence. I suspect, my suspicion is that the reason we locked down so quickly is that there was pressure to do so, but also that we kind of knew how to do so. South Africa has the machinery to lock down. It has a militaristic policing heritage and can do that very quickly, and so kind of knows how to do it. I suspect that was the case in some other African countries too. But when it comes to something that's different, which is procuring a drug and distributing it or a vaccine to a large number of people, there just wasn't the same infrastructure. So I suspect that's probably what explains it, rather than an abundance of caution.
When we do eventually get this vaccine to the country, I read a report a couple of weeks ago, I think it was in one of the newspapers, Professor, that there's only going to be enough for 3% of the population as well. Are you aware of any of those kind of statistics yet, what we could realistically use as a marker for the number of people that we can vaccinate? Part two of that question, I suppose, is more important, isn't it? Who do we vaccinate first? I, of course, would lean towards the healthcare workers and then those with comorbidities, but I'm not an epidemiologist. What are your thoughts?
I think one would need to vaccinate the people at risk, the frontline workers, and then you vaccinate the, as you've said, the people at risk. The difficulty is that public health strategy doesn't work like that. So this focus on the most at risk strategy is actually not the correct strategy for vaccination. I mean, or for many public health measures, that you have to you have to bring everybody up. So you get these situations, it's known as the prevention paradox, where a small reduction in risk across a large number of people means a large population benefit. And that is often the case in this kind of situation. So, of course, one does start with the most at-risk people, but you won't really see a change in the level of herd immunity unless you vaccinate a large proportion of people. It can't just be the people at risk. So, vaccinating 3% or 10% or any of those numbers is simply not enough. So, I mean, my assumption would be that really now that there has to be, and the government has to be trying to get hold of the vaccine as fast as it can and distribute it as fast as it can. And it's simply an administrative challenge for it at this stage, I think. So, and I guess we're going to see how well it rises to that challenge.
Well, I was about to ask you, so how would this then roll out? Let's say we get enough vaccine to give it to more than 3%, more than 10% of the population, essentially to make a difference around the population. Do we have the machinery in this country, based on what we've seen as far as testing is concerned and getting out to rural areas and areas perhaps a little bit off the map? Do we have the machinery in place now? If not, Professor Broadbent, do you think we're going to have it in place by the time we eventually get a vaccine, for the vaccine to even get to the people who need it, if you understand where I'm going?
I think the frontline machinery in South Africa is actually not bad. I think the issue is getting the supplies. So, South Africa's done quite well against HIV, for example. So it has that kind of experience of dealing with a disease and going out into rural populations and trying to test people and treat people. And so it does, I actually think, have the capacity on the kind of front line. I mean, I'm sure it could always do with more capacity, but I think the country will do quite well if it can, if the vaccine can simply be procured. The big fear, of course, is just that the small amounts get procured, they get absorbed into, and they basically fall off the back of the lorry, so to speak, and get absorbed into government officials, and you end up with the entire ANC branch offices getting vaccinated before the hospitals, and this kind of worry. So there's that kind of worry. I don't know to what extent that will happen. But as I say, I think the actual ability, once the public health system in the country on the front line is actually not bad, which is why we've seen a high proportion of testing. I also want to say, by the way, there's a strong scientific capacity in respect of genomic sequencing. I don't know if people realize this in South Africa, but most of the EU countries haven't detected a new variant simply because they don't have the ability to do so. So the UK does have genomic sequencing, but most of Europe doesn't, and that's why it's shown up in the UK. Another strain has shown up in South Africa because they're also testing, and scientists there are also doing the sequencing. So South Africa does have some good health capacity. It really is administrative support from the government side that can let things down when it does.
Yeah, we heard the President speaking about COVID-19 corruption, and you were just alluding to it as well. I think it's a fear of many people to ensure that we get it out to the right people. Professor, before I start saying goodbye to you for today, just your thoughts, if I may, on this new COVID variant this version 2, some people are calling it, of this new strain of COVID-19 here in South Africa, and a potential hard lockdown. Again, we're hearing there might be another family meeting sometime this week, I imagine before New Year's, but there's no confirmation. What are your thoughts on putting the country back into hard lockdown, considering how bad the numbers are now, and we're still in lockdown? What do you make of, A, the new strain? How concerned should we be really? And a potential lockdown, another harder lockdown?
I think the message has to be don't panic. I mean, there is a new strain in South Africa, there is another new strain in the UK, so there's these 2 new strains that are knocking around that have been detected. There are bound to be others. It's a specific feature of the coronavirus that it doesn't mutate as fast as flu. But it will mutate, so there will be others. That doesn't necessarily spell disaster. I think as far as lockdown goes, it has to be rational. I think it makes sense to ban large gatherings. I don't think it makes sense to keep people at home. If you look at the way the pandemic rose and fell through the country during the previous wave, it seemed to do so basically regardless of the lockdown measures. And I've published a piece on this. The rate at which the infection spread didn't respond to the changes in the levels of lockdown. So, and that's because lockdown works by increasing social distancing. 47% of households in South Africa have access to piped water. People are not going to be staying in their houses and they have to go out to get water. So, you have to do something that fits the place and fits the circumstances. So I think banning large gatherings, restricting sale of alcohol so as to protect the healthcare system, these things make sense. On the other hand, telling people they have to stay home and just blanket closing businesses is just going to cause a great deal of hardship and not be effective. So I don't think hard lockdown. I think some form of targeted mitigation measure would be the appropriate step.
It's always a pleasure speaking to you. Professor Alex Broadbent, all the best for a new year as well. I'm sure we'll speak to you once the President has addressed us in his next family meeting. Again, I can see on Twitter people, excuse me, asking when is the President going to speak? We don't know. It hasn't been confirmed yet. There is an expectation the President is going to have a family meeting, and this is why, because there's high-level meetings within the National Coronavirus Command Council that have taken place. Some of the biggest issues being discussed at the moment, of course, is this new strain of COVID-19 and what kind of lockdown level do we need to go into. I understand that we're going to be bringing you the numbers. Over 9,500 cases have been recorded in just the past 24 hours. And as we've just been speaking to the professor about over 1 million cases in South Africa in total now.